Root Cause Analysis by Kim, Patricia, Dee, and Ashley. So, what is a root cause analysis? Well, according to Pearson, it is an approach for identifying the underlying cause of an adverse event so that the most effective solution can be identified and implemented. It's typically used when something goes really bad, but it can also be used when an unexpected good outcome occurs because we do want to reproduce that. And the central principle of root cause analysis is just to basically have a blame-free environment because as human we do create or we do tend to make errors because we're so busy doing our tasks that we overlook certain things. And the purpose of this is just to identify what went wrong so that we can find a solution and fix it. So there are three questions that you want to ask before formalizing a root cause analysis, and they include what's the problem, why did it happen, and what can be done to prevent it from occurring again in the future. Because the ultimate goal is just to prevent future harm by eliminating the land error that often underlie the adverse event itself. So root cause analysis is about digging beneath the surface of a problem. So here on the slide, you can see that the green part, which represents the weed, and that is the problem presenting on the surface itself. Underneath that is the root. And you don't want to just focus on a single root. You want to see it as multiple branching roots stemming out from the weed underneath because just seeing one, it limits the possibility of having solutions because, with an error, anything can go wrong. It's not just one thing that caused it. And that's why we need to see it from all different corners. So the root is basically a system of causes that review all of the different options for solution. And the result is that multiple opportunities to lessen risk and prevent problems from occurring again in the future. By eliminating root causes, we are no longer repeating the problem. We are reducing rework, retest, reinspect, and just having a better cost-effective approach. And the problems are prevented in all areas, hence why we look at multiple routes. And then we identify current and future needs for organizational improvement. And communication between team members are better because information are being relayed in a more structured way. And before we go into seeing how a root cause analysis is done, it's best to understand some of the key concepts within a root cause analysis or key concepts that precipitate why a root cause analysis is needed.
Hello everybody, my name is Patricia Nemeth and today I'm going to talk about sentinel event. So what is sentinel event? A sentinel event is a sudden happening that affects a patient while the patient is in a hospital and resulted to the patient death, permanent harm, severe temporary harm, and an intervention was required to sustain the patient's life. Example of those sentinel event is wrong side surgery. That's why before any surgery, a timeout has to be conducted before the surgery will take place. During timeout, the name of the patient, the type of surgery, the site of surgery, and even the medication that will be given to the patient will be announced before the surgery. Or administration of incompatible blood transfusion. Before any blood should be given to a patient, two nurses have to confirm that the right blood is being given to the patient. On medication error, as nurses, we have to know the 5 rights of medication: the right patient, the right drug, the right dose, the right time, and the right route to prevent sentinel event or discharge of an infant to the wrong family or suicide within 72 hours after discharge. All that shouldn't happen to prevent sentinel events. Thank you. The Joint Commission encouraged accredited organizations like the hospital to report sentinel events and to address 5 components: trust, accountability, identifying unsafe condition, strengthening system, and assessment. Let's talk about trust first. As a nurse, you have to create an environment of trust by being transparent to report unsafe condition, adverse effect, and near misses. Then accountability. As a nurse, we have to hold ourselves accountable because we are mandatory reporters. We have to report everything that happened that is unsafe for the patient. Identifying unsafe condition. Let's say, for example, you have a patient that has a pressure ulcer, and you know that pressure ulcer is getting worse and will result to infection, and the patient might die from it. You have to report it. You have to call the doctor about it. Strengthening system or assessments. We as nurses, what we do first when we see a patient is to assess the patient. You can do your assessment during giving a bath. You can do your assessment during talking to the patient. You can do your assessment even by just listening to the patient's lungs. During assessment, we find out things that the patient forgot to tell us or they didn't know about. Thank you. Breach of care. Breach of care occur when a nurse deviates from the standard of care. Example of breach of care is giving incorrect or wrong medication, failure to identify worsening pressure ulcer, failure to contact the physician for additional treatment for the patient. Nurses can reduce the risks of breach of care by reporting in a timely manner, remaining current with skills and education, and documentation. Remember, if you didn't document, you didn't do it. That care wasn't given to the patient because it wasn't documented. Thank you. Targeting area of improvement. Targeting area of improvement takes place when the level of performance by the organization is being compared to industry standard, and areas that need improvement will be addressed. Example of that is enhancing employee knowledge and skills through policy and procedure, the use of specific ointment for wound during dressing change, and by doing that, we increasing or facilitating the wound healing and decreasing the time that the patient spent in the hospital, or regular checking of vital sign on an older patient after a pacemaker implantation. We're doing that to monitor any complication that might arise after the pacemaker implantation. Thank you. Risk management. Risk management is a strategy to identify risks, then implement changes to reduce consequences or liability. The process includes patient questionnaire or past adverse events. For example, in most units, the nurse manager will go to patient rooms, asking them how their day has been, if anyone is answering the callback, or how long they have to wait whenever they call the nursing station, or analyzing new procedure and its risks on patients. If a new procedure is about to be done on patient, the doctor have to analyze that procedure in detail before it to allow it to be done on the patient, or staying current with laws pertaining healthcare. As nurses, we have to stay current with nursing journals or healthcare journals so we can follow up with the trend because the healthcare system changes every day. Thank you.
Patricia. Okay, guys, let's get to it. The first thing you want to do is prepare for the root cause analysis. You want to organize a team that can provide an honest, objective assessment of the event. Then you want to define the problem by describing what happened or what almost happened. You're going to need to get together witness statements and observations, physical evidence, and documentary evidence. The next step in root cause analysis is determining proximal cause. What happened? Where did it happen? And when did it happen? I've outlined the 5 whys in the PowerPoint, but basically the team answers the question why, as many times as needed until the root cause of the initial problem is identified. Determining proximal cause forces the team to investigate the root cause at every angle. Review any other factors that have directly influenced the outcome. In step 7, you will need to measure, collect, and assess all the data on underlying causes. In step 8, you may find that some changes will need to be addressed immediately. This is the time to do so. After successfully determining proximal cause, you are now ready to move on to the next phase. Okay, so when it comes to the root cause analysis, you're going to want to identify which systems are involved. This stage of the process may be the most challenging because the team has to critically focus on searching for system problems versus focus on human errors. Two questions you want to ask yourself when pruning the list of root causes is number one, if we fix the problem, will it reoccur in the future? And number two, if this problem is the root cause, how does it explain what happened or what could have happened? Next, confirm root causes and consider their interrelationships. This can be done with problematic systems and process checklists. All right, team, let's move on to the final phase of this process, designing and implementing a corrective action plan for improvement. After your root cause has been successfully identified, you're going to need to explore and identify risk reduction, formulate improvement actions to mitigate effects by using something I like to call mistake proofing. Step 14 involves critically evaluating improvement plans and discussing any potentially negative consequences. The next steps are to evaluate the effectiveness of the improvement actions by asking what, how, when, who, and where. Ensure acceptability of the corrective action plan, then implement the improvement plan. The final steps of conducting a root cause analysis is not only creating change, but managing change. Now, at this point, you need to develop a vision and strategy that ensures long-term success. You should now focus all of your efforts on communicating, standardizing, and introducing the successful improvement initiatives. Finally, after determining what happened or what could have happened, after identifying root causes of the event, after providing recommendations for improvement actions to prevent reoccurrence, it is now time to communicate your results. Okay, guys, so that wraps up root cause analysis. I hope you learned a lot. Feel free now to answer a few questions to reinforce your knowledge. And remember, you can always pause the video if we're moving too fast. Thanks, guys.
Question 1. What statement should the nurse use to describe the purpose of the root cause analysis? The answer is A. Root cause analysis identify areas of improvement that would decrease the likelihood of future adverse events and to develop an action plan for improvement. Outcomes created would be the goal that root cause analysis would help achieve. Identifying risk and providing a report are unrelated to the purpose of root cause analysis. Question 2. The nurse involved in risk management committee is creating an action plan to begin reviewing ways to reduce medication errors. The nurse knows to include which of the following components. Select all that apply. The answer is A, B, and D. Action plans include components of identifying who is responsible for implementing and overseeing improvements, pilot testing to ensure the success of the changes, how these changes will be implemented, and strategies for measuring their effectiveness. The 6 right relate directly to how to reduce medication errors, not the action plan to determine the root of the why these errors are occurring. Lastly, root cause analysis focuses on group or population where errors reside, not specific person. Question 3. The nurse manager is educating her nurses on what a sentinel event is and what some examples are. Which would the nurse manager present as examples of a sentinel event? Select all that apply. The answer is A, B, and C. A sentinel event is an unexpected occurrence causing serious injury or death. Delivery medication to the wrong unit is not a sentinel event because injury or death did not occur. Administration of a compatible blood transfusion would be desired. Administration of an incompatible blood transfusion would be a sentinel event. All right, thank you everybody for watching our video. Hope you learned a lot today.